So hello students, and let us understand this very important topic from the point of view of exams, the triangles of the neck. Now, the details of posterior triangle, anterior triangle, muscular triangle will deal in subsequent lectures. But just let us understand a brief outline about the various triangles in the neck, which muscles are going to form the boundaries. MCQs are exactly asked on this. Okay, so let us start. I'm Dr. Pradeep Pawar. Let us start with the triangles of the neck. Have a look at the slide, students. Let me draw the slide for you. Now we draw a small face. In the earlier lecture, we have seen the nerve supply, we have seen the motor nerve supply, we have seen the venous drainage, we have seen the arterial supply of the face. Okay, so now what is this for the mandible? The body of the mandible. What is this for the mandible? Ramus, correct. What is this junction known as? Angle of the mandible. And students, the skin over the angle of mandible is supplied by whom? Yes, very good, the greater auricular nerve. And this greater auricular nerve is a branch of, what do you say? Cervical plexus. We'll see the cervical plexus later. Right, now that's the ear. And what is this bone, students? What is this bone right behind the ear? The mastoid process. Any guesses? The mastoid process. What is the type of epiphysis? Another very important MCQ. Mastoid process is an example of, yes, traction epiphysis. This epiphysis is formed because of the pull of the muscle. So that is traction epiphysis. One example is mastoid process. Fine. Now you tell me, what is this muscle which begins from the mastoid process and comes down like this? A muscle which has got two heads, a sternal head and a clavicular head, and this muscle goes and gets inserted into the mastoid process. Yes, the sternocleidomastoid. Very good, sternocleidomastoid. Any guesses about the nerve supply of sternocleidomastoid? The spinal accessory nerve, spinal accessory, right? And now students, can you tell me what is this muscle going to be? Let me just slightly clear this. Okay, so what is this muscle which is going behind like this? This muscle here, this muscle, which is also supplied by the spinal accessory nerve. Any guesses? That's the trapezius. So sternocleidomastoid and the trapezius, both of them are supplied by the spinal accessory nerve, correct? What is this, students? This is what we call as the midline of the neck. Midline, here. That's the midline of the neck, correct? And what is this here? That's the clavicle. Clavicle for you. That's the clavicle. Let me just be very specific, right? That's the clavicle. Now we draw an imaginary line. We draw an imaginary line from the angle of the mandible to, we draw an imaginary line from the angle of the mandible to the mastoid process here, from the angle to the mastoid process. Now this becomes the site of the neck. Are you perfectly clear? What are the boundaries of the site of the neck? Who's in front? Midline of the neck. Who's behind? Trapezius. Who's below? Clavicle. And who's above? The body of the mandible. The body of the mandible, and a line drawn from the angle to the mastoid process. Line drawn from the angle to the mastoid process. So this becomes the site of the neck. Now this side of the neck is divided into two triangles by the sternocleidomastoid. Students, so now you tell me, what is this triangle going to be? Anterior. And what is that triangle? Posterior triangle. So what are the boundaries of anterior triangle? Who's in front? Midline of the neck. Who's behind? The sternocleidomastoid. And who's above? The body, and an imaginary line drawn from the angle to the mastoid process. That's the anterior triangle. Clear? Boundaries of posterior triangle. Sternocleidomastoid in front, the trapezius behind, and the clavicle below. So that becomes the posterior triangle. I hope I'm clear to all of you, right? Very good, very good. So now let us now go further. What are the subdivisions of this triangle? Can anyone tell me what is this? Can anyone tell me what is this bone here? What is this bone here? What is that bone? A bone which is derived from the second pharyngeal arch. Any guesses? Right, this is the mandible. The symphysis mentae goes straight down. Yes, what is this bone here? Very good. That's the hyoid bone. Hyoid bone. Go further down from the hyoid bone. What is this that you get in the midline? The thyroid cartilage. Thyroid cartilage. Go further below, you get a C-shaped cartilage. What is this? The cricoid cartilage. And go further down, we come to the suprasternal notch or the manubrium notch. Okay, suprasternal notch. So midline structure, this is the symphysis mentae, the hyoid bone, the thyroid cartilage, the cricoid cartilage, a very prominent C which is in here, and then the suprasternal notch. Perfect. So that's the hyoid bone. And students, now if you can tell me, there's a muscle here. There's a muscle which begins from the scapula and which comes and gets inserted into this hyoid bone. Any guesses here? So this muscle begins from the scapula. You know, this is the behind is the scapula, and it comes to the hyoid bone. This muscle is what we call as the omohyoid muscle. Now, student, this omohyoid muscle will have two bellies, right? Bellies. The one belly from the sternocleidomastoid to the hyoid bone. This is what we call as the superior belly of omohyoid. Perfect. The second one from the sternocleidomastoid to the scapula behind, that's the inferior belly of omohyoid. Students, let me just write this down for you. Okay, the superior and the inferior belly. Look how nice. What is this? This is the inferior belly, inferior belly of omohyoid. I'm not writing this complete. Omohyoid. You can understand this. And this is the superior belly of omohyoid. This one, superior belly, that's the inferior belly. Students, just appreciate this. The posterior triangle is now divided into further two triangles by the inferior belly of omohyoid. Correct? Can you appreciate this? Yes, very good. So what is this triangle above? This is what we call as the occipital triangle. Occipital. And this triangle is above the clavicle. Look, this triangle is above the clavicle. We call this as the supraclavicular triangle, or a very important artery lies in this triangle. A very important artery. That's the subclavian artery. We call this triangle, therefore, as the subclavian triangle. Subclavian triangle. Clear? So these are the various triangles of the neck, the subdivisions of the posterior triangle. Are you able to understand this? What are the subdivisions of the posterior triangle? Yes, let me just write this down for you. So this triangle becomes the occipital triangle, right? And this becomes the supraclavicular or the subclavian. It's the same. Supraclavicular or the subclavian triangle. Perfect, students. Clear? Are you understanding it? You're getting a hold of this triangle? Yes. The posterior triangle is further divided by the inferior belly of omohyoid into an occipital triangle above and a supraclavicular or a subclavian triangle below. Perfect. Right. There's one more muscle, students, which has got two bellies. Look at this, appreciate this. A muscle which begins from the mastoid process, a muscle which comes and gets attached to the hyoid bone, and the muscle then goes to the mandible. Here, mandible, if you see the mandible, the body of the mandible, on the posterior aspect, there's a fossa, and this fossa is what we call as the digastric fossa. Digastric fossa. So what is attached to this digastric fossa here? The anterior belly of digastric muscle. Anterior belly of digastric. So students, if that's the anterior belly of digastric, what is this going to be? Yes. Very good. The posterior belly of digastric. So the anterior, and that's the posterior belly of digastric. Now these two bellies of digastric are going to divide the anterior triangle into further many triangles. Let us understand this first, students. So let me label this for you. What is this belly of digastric? Let me label this. That's the anterior belly of digastric. This one, anterior belly of digastric. And what's that? Posterior belly. Posterior belly of digastric. Right? So that's the posterior belly, that's the anterior belly. Now see, now we get many triangles here. Students, can you appreciate these triangles now? Just have a look. I'll just put numbers for you here. Come on, students, come on. What is this? Number 1. What is this? Number 2. What is this? Number 3. And what is this? Number 4. So these are the 4 triangles, 4 small triangles which belong to the anterior triangle, right? See, these are the parts of anterior triangle. Correct, no, students? These are the parts of anterior triangle. So subparts of the anterior triangle. What are the boundaries of anterior triangle? What's this? The midline of the neck. That's the sternocleidomastoid, and that's the body. And imaginary line drawn from the angle to the mastoid process. Now, this anterior triangle is further divided by the superior belly of omohyoid and the anterior and posterior belly of digastric into many small triangles. Right, let us understand this. Triangle number 1. What are the boundaries of this triangle? Come on, students, come on, answer this. Who's this in front, the midline of the neck? Who's this above, the superior belly of digastric? And who's this behind, the sternocleidomastoid? A triangle here which is bounded by the midline of the neck, the superior belly of omohyoid, and the sternocleidomastoid. And in this triangle, we get only muscles, and muscles, and this muscles look like a belt. This is what we call as the strap muscles. Now these muscles are below the hyoid bone. Yes, what do you call them as? Infrahyoid muscle. Excellent, students, you are answering very well. So this muscles are also known as the infrahyoid muscle. What do we get in this triangle number 1? Only muscles, and muscles. This triangle is therefore known as the muscular triangle. Am I clear to all of you? Muscular triangle. So what is triangle number 1? That's muscular triangle. It is a part of anterior triangle. Boundaries, I hope I'm clear. Later, we'll discuss this in details. What are the muscles? What is the nerve supply of this muscles? Another very important MCQ topic is this muscular triangle. Clear, students? So, midline of the neck, the superior belly of omohyoid, the sternocleidomastoid. Perfect. Very good. Coming to triangle number 2, let us understand the boundaries of this triangle here, students. What is this here? The sternocleidomastoid behind. What's this in front? The posterior belly of digastric here. And what's that? The superior belly of omohyoid. So this is the triangle that I'm telling you. In this triangle, students, the common carotid artery comes here, divides into 2 terminal branches, the external and internal carotid, right? The external carotid gives branches here to supply the head and neck. This is therefore known as the carotid triangle, right? It's the main common carotid with its branches, with the branches of external carotid. So this triangle rightly known as carotid triangle. Clear to all of you? So that's the carotid triangle. That's the carotid triangle. Clear with the boundaries? I'll just repeat that. Sternocleidomastoid behind, the posterior belly of digastric in front, and the superior belly of omohyoid. That's the carotid triangle. Perfect. Triangle number 3. Any guesses? That's the anterior belly of digastric. That's the posterior belly of digastric. And that's the body of the mandible. Now, in this triangle, number 3, we get a gland here. Here. Exactly here. That's the anterior belly. That's the posterior belly. And that's the mandible. So, right here, we get a gland right here. That's the submandibular gland. And this triangle is therefore known as the submandibular triangle. Or this is the anterior belly, that's the posterior belly, which is going to bound this triangle. This triangle is therefore known as the digastric triangle. Very important MCQ, students. Very important MCQ. Number 3, digastric triangle. And what lies in this triangle? The submandibular gland. The submandibular. We'll see this later, right, students? I hope you're enjoying this, understanding this. Very good, very good. Coming to the last triangle. Now, these are complete triangles. 1, 2, and 3 are complete triangles. Number 4 is half a triangle. A small half triangle here, a small half triangle here. So that becomes a complete triangle. So what we are seeing from one side is only half a triangle. What are the boundaries of this triangle? Here, the midline of the neck, the anterior belly of digastric, and the base is formed by the hyoid bone. Midline, anterior belly, and the base is formed by the hyoid bone. This lies below the chin. That is the submental triangle. Number 4, I would write it here as submental triangle. Submental triangle. We get small lymph nodes here, so the submental lymph nodes. Students, a very important topic for you. Very important topic from Viva, from the MCQ point of view. Clear? So the various boundaries. I hope I'm clear to all of you. So the posterior triangle is divided by the inferior belly of omohyoid into an occipital and a supraclavicular. Anterior triangle divided by the superior belly and the anterior and posterior belly of digastric into one muscular, second carotid, third is digastric, and fourth is the submental triangle. Let us have a look at the slide and understand it still better if this comes as a visual slide for you. Okay, have a look at this. Wow, that's superb. Appreciate the students. Yeah, so I'll just put numbers here. Can you just tell me what is this number 1, what is this number 2, what is this number 3 that I'm labeling here, and what is this number 4? So 1 is the sternocleidomastoid. Very nicely identified it as sternocleidomastoid. 2 is the trapezius. 3 is the midline. And 4th is the clavicle. So what is this triangle here? That's a posterior triangle. And what is this triangle here? That's an anterior triangle. Anterior triangle. Clear? Now just try to understand this. This posterior triangle, which is bounded by sternocleidomastoid, trapezius, and the clavicle, right? Now, what is this muscle? This is the omohyoid. Omohyoid, the inferior belly of omohyoid. So, what is this triangle? What is this triangle? I'll just put dotted dot here for you. This is the occipital triangle. Occipital triangle, and we have a small, what is this triangle? Supraclavicular triangle. So the posterior triangle is divided by the inferior belly of omohyoid into a occipital triangle above and a supraclavicular triangle below. I hope this is clear. Later we'll discuss this posterior triangles in details in some other lecture, right? Now, what is this number 1 and what is this number 2? So that's the anterior belly of digastric, that's a posterior belly of digastric, and what is this number 3? That's the superior belly of omohyoid, or this we take it as superior belly of omohyoid, number 3, superior belly. So now you tell me, students, what is this triangle here? What is this triangle? Look, just one moment. So for the sake of convenience, I'll take this as the superior belly of omohyoid. So what is this triangle here? What is this triangle? That's a muscular triangle. You can see all muscles here, so muscular triangle. What is this triangle bounded by the posterior belly of digastric, the sternocleidomastoid, and the superior belly of omohyoid? That's the carotid triangle. This triangle, which is bounded by the posterior belly of digastric, anterior belly of digastric, and the body of the mandible, that's a digastric triangle. And we get a small triangle here. Look at this small triangle here. This is the submental triangle. Submental triangle. Students, I hope this is clear. Look at this once again. So that's a muscular triangle, that's a carotid, that's a digastric, and that's a submental triangle. I hope I'm clear to all of you about this triangles of the neck, students, right? In case of doubts, do get back to me. Happy learning till then. Thank you.